I hope we have, and I hope that this will interest you in a clinical approach to what is actually the commonest skin tumor of horses. It's probably the commonest tumor of all, and to try to dispel some of the myths associated with this disease. So when we're talking about a clinical approach to a disease, we need to have clinical objectives, and that these objectives are in the form of a dartboard, I suppose, where we're always trying to get the score that we actually want to win the game. And as a consequence, we have some targeted objectives here. And the first of these, of course, is to make a definitive diagnosis. You can only treat disease when you have a diagnosis. And Tony Stannard, a very well-known and very good friend of mine, was a veterinary pathologist, said that once you have made a diagnosis, only then can you offer appropriate treatment and an appropriate prognosis. Otherwise, it becomes guesswork, and we do not really want to do that. So we consider the differential diagnosis for all of these conditions that we deal with. And you'll see why that's important when we come to discussing the sarcoid types in a minute, because each type has its own set of differential diagnosis options. So that means inevitably, of course, that we may have to carry out tests to either eliminate or to confirm the presence of a sarcoid, or to eliminate it indeed. We have to define the subtype and variations of any condition that we are investigating, and you'll see why that's important in a minute, because it does affect the treatment options available to you. So obviously, if you have a small localized tumor of any sort, it becomes easier to deal with rather than a lesion that is very diffuse, very difficult to define. So treatment options vary according to some factors, which we will also discuss later on in this program. Does it affect the prognosis? Well, yes, it does, because some subtypes are very static, some diseases are static, some are very progressive and very rapid and deteriorate very quickly. We need to provide effective evidence-based treatment, and that is the key to the successful management of any particular disease. And it doesn't matter that this is a sarcoid or a carcinoma or a coughing horse or a lame horse. You have to provide evidence-based treatment. And that, in this particular disease, is one of the issues that we do face, because there's actually very little true evidence available for many of the treatment options. And then we have to provide the owners with a prognosis, because ultimately owners only want to know what's going to happen to their horse. They want to know, is it going to get better or not? They may be interested, of course, in finding out whether the horse is going to take a long time to get better or whatever. But ultimately, they want to know that the horse is going to not require long-term treatment, or even if it does require long-term treatment, how long that is likely to be. So what is a sarcoid? Well, a sarcoid is a common skin tumor of horses, of any equids, in fact, because it affects donkeys, horses, mules, and zebra, as well, as you can see here. There's some donkey ones and some zebra ones and some mule ones and some horse ones. As you can see, it has a worldwide incidence, but somewhere between 2 and 10% of horses are affected in countries across the world. I have not yet come across a country where there is no sarcoid. Now, I believe there are some where people say there is none, but I would like to go there and find out for myself, actually, in the end.